Good morning. Before we get started, please note that closed captioning is available. Please click on Show Captions to turn on captioning. Click it again to turn off the captioning. Microphones are muted. We have several hundred people on the webinar and we want to minimize extraneous sounds. Please put questions in the Q&A. We will answer as many as time allows after each speaker. Please note that there is a code of conduct for this symposium. Please see the link to that in the chat. Note the chat is only available for hosts and co-hosts. My name is Julia Esparza. I am Associate Director of the Louisiana State University Health Shreveport Library. I am Professor of the Department of Medical Library Science and Comegys Endowed Professor of Medical Library Science. I would like to welcome you to our Maternal Morbidity and Mortality Symposium. I am the principal investigator with my fellow co-investigators, Elliot Freeman, Research Writing Librarian, Sarah Jackson, Education Librarian, and Aaron Ware, Reference Librarian, on this award that led to the symposium. Funding for this symposium was provided by the network of the National Library of Medicine, Region 3, through a Health Information Outreach Award. Region 3 covers Arkansas, Kansas, Louisiana, Missouri, Nebraska, Oklahoma, and Texas. We appreciate their funding. In order to obtain the funding, we had multiple organizations that supported our application. We would like to thank them at this time. The first supporters were the Departments of Family Medicine, Internal Medicine, Obstetrics and Gynecology, and Psychiatry and Behavioral Health at Louisiana State University Health Shreveport. Next, we would like to thank the State of Louisiana, Louisiana Department of Health, Bureau of Family Health for their support in obtaining the award. If you would like to learn more about their programs, go to their website. There is a webinar on their recent success, and the latest report can be found there as well. Information about the Louisiana Perinatal Quality Collaborative can be found at its website. All of these links are being put in the chat. We would like to thank our community partners for their assistance as well in obtaining the award. Here are more of our partners and the last of our partners. It is very important for community partners to be involved in awards, and without them, we cannot be successful. We are very excited that as of this morning, we had over 950 continental U.S. and 62 international registrants for the symposium. Here is our agenda. We will try to stay strictly on schedule. Please note the relevant disclosures for our symposium. At this time, I would like to introduce the medical director of the symposium, Dr. Zurab. Dr. Zurab is from Louisiana State University Health Shreveport and is the chair of obstetrics and gynecology. Joining him in opening comments is Ms. Tier, who is Chief Nursing Officer of Ochsner LSU Health Shreveport St. Mary Medical Center. Dr. Zurab, you can begin.
First of all, good morning. Thank you very much, everybody, for joining us this morning for this webinar. This conference and symposium have been set up so that we can help our community. Thank you very much for being interested in attending and in supporting this. We could not have done this without the help of Ms. Esparza, who's put in so much effort with her colleagues. And the key thing about this is supporting, again, as I mentioned, the community. This conference and symposium specifically will be focusing on topics that we typically don't hear a lot about. For example, nowadays we're having issues with mental health. This is one of the topics that we're going to talk about and address it in the rural regions as well as in our regular communities. You will notice that there are topics that have to do with emergency care, topics that have to do with telehealth, topics that have to do with postpartum hemorrhage, and many more. We appreciate you attending. Thank you very much for supporting us and supporting this symposium and supporting every community that you're at. Once again, thank you, and I will turn the mic to Ms. Tier.
Good morning. I want to also thank you for taking the time out of your day to be able to represent and be a part of this symposium. Maternal morbidity and mortality is very dear to my heart, and I appreciate that the number of colleagues that have gotten on here and that are focused on making our regions better at being able to serve this type of clientele. In the future, I think this is a drive that not only will help our moms, will end up helping our little ones in the end in our NICU. Thank you again for attending.
Mrs. Esparza, I turn the mic to you.
Thank you, Dr. Zurab and Ms. Tier.